Hey guys, so we're going to go through today a series that's on the core. And in order to talk about the core, we need to understand what we're talking about in an elementary level, but a little more than surface deep. So what is the core? For our purposes today, we're going to talk about the core as the hips, which are the ilium, these ringed inanimate bone, the ilium, and the sacrum, right? Our tailbone, the sacrum, is basically fused vertebral column, comes up. So we have 5 lumbar vertebrae, we have 12 thoracic or mid-back vertebrae, and we have 7 cervical or neck vertebrae. All right, all of that, our scapula ties in. So it's really hard to just take a reductionist view when we're just looking at segments of the body. It's almost irresponsible, so we at least have to tie the hips and the trunk together. We talk about the abdominal cavity, the thoracic cavity, and it's important to understand the kind of basic mechanism. When we inhale or inspire oxygen, our lungs fill up and push our diaphragm down. So my diaphragm, each time I inhale, my diaphragm pushes down against my visceral guts, right? Our internal organs, this ball of fluid and organs, is pushed down into the pelvic floor. Their structure is called the levator ani that push back up against the guts and against our abdominal wall. So there's this dynamic interplay, and we can't talk about the trunk without talking about the visceral guts. Obviously, on top of the skeletal structure are all the musculature that we're going to try to train. The musculature of the hip. Obviously, we have internal and external obliques that sit like a corset. The transverse abdominis, a lot of you have heard of that, sits like a corset as well and creates what we call hoop tension. And on top of that is our rectus abdominis, and that's a pretty simple overview of core musculature, but we can't just talk about this anterior or front aspect without discussing some of the structures in the back. And you just have to imagine that our back, you can notice this lordotic curve that our lower back has. This lordotic curve are this convex nature of this kyphotic curve of the thoracic spine. And all of this, there's all of these structures that run longitudinally along our vertebral column. The thoracolumbar fascia is this soft tissue webbing that keeps our low back stable. And underneath that is the lumbar multifidus and our paraspinals, which run longitudinally, and a lot of those structures attach to every vertebral body. And you have to remember that all these are moving pieces. So really, the core is kind of complex, a lot of musculature involved. We're going to go through a workout today that's basically just focused on the core. And again, when we're talking about the core, we're talking about all the posterior structures, the lateral or oblique structures, and again, the anterior structures that envelop our core.